All right, so now we'll get into just some basic overview things as far as about anatomy. We have the different planes of the body. There's three primary planes. So basically it's a three-dimensional thing. It's like with math, you have the X, Y, and Z axis. Right? So you have the sagittal plane, which is should be this one here. So it's slicing the body into the right and left half. If you go right down the middle, it's the mid-sagittal plane. Anything else would just be a sagittal plane. Right? So Anat. Okay? So a plane is something like say like a sheet of plywood. Okay? There's movement in that plane. So within each plane, let me just go to this. I'll leave this up in case anybody needs to write this stuff down. So again, to review, you have the mid-sagittal plane would be dividing into equal right and left halves, or you can have other sagittal planes, which would be parallel to that. Then you have the transverse, or the frontal or the coronal plane. That's named by the coronal suture. We'll talk about that in the brain. So anything in this plane is the frontal or the coronal plane, and then the transverse plane. And I don't think this part is in the notes, so you may want to put this in. And this gets into, like, when you get more into orthopedics and stuff, and you talk about measuring range of motion, I was talking about the three P's of range of motion. So first you start with the planes. And then in each of those planes, you're going to have a paired motion. So does anybody know in the sagittal plane, what would this motion be? Flexion and extension. So you're going to have flexion extension in the sagittal plane, and then going in and out like this in the frontal or the coronal plane is going to be add, always going towards the middle, abduction going up like that. And then in the transverse plane, what would that be? Rotation. Okay? So you have flexion, extension, abduction, adduction, and rotation. In the spine, it's just right rotation, left rotation. In the extremities, it's external rotation and internal rotation. Okay? All these different things, we're going to do a whole class on joint movements and things, so we're covering all this a lot more. And then you have other special movements like pronation, supination, inversion, eversion, things like that. But it's always going to be in a pair. Okay? You have one and then the other. And then when you measure range of motion as far as for examination purposes, you do a certain progression of range of motion. You ask the patient to actively do range of motion first, so it's active range of motion. So you say, okay, bring your chin to your chest, bend your back, turn this way, turn that way. Then you do passive range of motion where the examiner is going to move it. Passive range of motion. Then you do active resisted where you say, I'm going to press this way, I want you to resist. So active resisted range of motion. And then these all have these different abbreviations and things. So these active, passive, stuff like that, you don't necessarily need to know that for this class, but just, you'll hear that later. Right, then there's a whole bunch of different terms that apply to the regions of the body. And these are in the textbook, and obviously they're also in the notes. So when we talk about cephalic, that's always going to be pertaining to the head. And then caudal or cauda is pertaining to the tail. And we'll talk later about neuroanatomy. Actually, we don't really get into that in this class, but you have the cauda equina, which is that very end of your spinal cord. And then cranial is going to do with the skull, facial with the face. Cervical is going to be pertaining to the neck or the cervical spine. And I don't necessarily need to go through all these terms, but basically you need to review these in the notes in the book and just make sure you understand what those terms are. Because as we talk later about different parts of the body, when we say popliteal fossa or cubital fossa, you need to know what these are. Because basically in this, if we're studying anatomy, you need to talk the talk. Basically, you just need to learn the language of anatomy. When you're talking about anatomy, you use the words. So if you're talking about now that you're studying anatomy, you don't say the front of my arm, you say the anterior aspect of the forearm. Or you just need to talk the talk. So that's basically what you need to start learning all these terms so that when you're talking about anatomy, you know the proper terminology. Because it's more precise than just saying, you know, my neck hurts. Well, what part of your neck? The anterior, lateral, medial, distal, proximal, all that stuff. So then here we're getting into more of the different parts of the lower body. So you have the pelvic girdle, the sacrum, coccyx, femur, tibia, fibula. And in the body, when you talk about the upper body, upper extremity, this is the arm and this is the forearm. When you talk about it in the lower extremity, this is the leg and this is the thigh. So it's the other way around. When you say arm, the upper arm is actually the arm, and then you have the forearm. In the lower extremity, you have the thigh, and then when you say leg, technically you're talking about between the knee and the ankle. And then here's getting into some things into the feet. You talk about tarsals, pedal, and then dorsal and palmar. Then dorsal is going to be the backside surface, and then palmar would be the front side surface. So just make sure you go through all those and review and make sure you understand those different terms. And then now it's important that when we're talking about different parts of the body and anatomy, that we all have the same reference point that we're starting from. And that's going to be anatomical position. Okay, so when you're trying to figure out, like we say on the wrist, which is flexion and which is extension. If you start from, here's anatomical position, where the palms are facing forward, like this. So then you know flexion is basically moving anything forward like this. So this is flexion and this is extension. So you always have to start from anatomical position, because once you start getting into, when you get into origin insertions and actions of muscles, you always got to think, okay, here's anatomical position. So then you need to know, if you talk about what's abduction, adduction, you just have to have a common reference point so that everybody knows what we're talking about. So basically that's going to be the body in a standing erect position, the feet slightly apart, palms facing forward, and then the thumbs are pointing out away from the body. So if we say, based on anatomical position, it would be this. So now at least we know all what we're talking about when we say anatomical position as a starting point. And then we talk about different directions. And then it's kind of like in range of motion, we talk about pairs of range of motions. You have pairs of directions, directional pairs. You know, so you either go one way or the other. If you're giving somebody directions, say either you go right or you go left. You go up the hill or down the hill. So in this case, we're talking about in anatomical terms. And in this case, we have a couple different words that mean the same thing. So superior is meaning always going to be up, or you can also say cranial or rostral. So that's moving upwards towards the body. And then opposite of those is going to be what? Inferior, caudal. And there's not a pair, I guess, that goes with rostral. And then anterior is going to be also called ventral. So that's the front side. And then posterior is going to be dorsal. Just think of like on a fish, you have a dorsal fin. Right? So the dorsal. And then also the thoracic spine sometimes is also called the dorsal spine. Then you have medial and lateral, and then intermediate would be somewhere in between. So medial is moving towards the midline, lateral is moving away from the midline, and then intermediate would be somewhere in between.